Hello, lovelies. Welcome to the Fat Joy podcast, where we talk each week about how to flourish in an anti-fat world. I'm Sophia Apostol, a fat professional coach who loves talking to other fat people about what it's like to live within oppressive systems that marginalize our bodies, and how we still dare to have the audacity and courage to reach towards our collective liberation and embrace our joy. Please know this is an adult content podcast, so there will be swears, we will be talking about harms we've experienced, and we will be rebelling against weight stigma, diet culture, fat phobia, ableism, racism, etc. You can get more Fat Joy goodness, including how you can support the podcast, through my newsletter at fatjoy.substack.com. And for episode transcripts, book reviews, and show notes, head to the Fat Joy website at fatjoy.life. I am so glad you're here. Enjoy this episode. Hello, lovelies, and welcome back to the Fat Joy podcast. I'm Sophia, and I am so excited to be joined by Christina Hughes today. Hi, Christina.
Hello. Thank you for having me.
I'm very excited to talk to you. So I've been following you for a little while, and I mentioned this before we even started recording, but you made this video that I've shared, I think twice now, about how fat people are supposed to wear their seatbelt, which in a way on the surface has nothing to do with what you actually do. But every time I share it, I get people writing me saying, oh my God, thank you. I had no idea. And I had no idea when you shared it. So I want to start by saying, like, the bits of information that you share on social, this is for everybody, helpful tips like this. It's amazing the ripple effects it can have. Like, I feel like if I were in an accident, you just saved my intestines, you know?
Right. Yeah. We don't talk about fat bodies, right? Because it's often a shameful off topic, conversation where no one wants to be fat, right? In quotes, right? And so we don't talk about how to accommodate those bodies and how to make the systems and physical things that we live with every day, right, work for our bodies.
Yeah. And I'm just so appreciating, I'm starting to see a little more of this. Like, I think, is it Anna Chapman who does like fat self-care? So, I'm not sure of their pronouns, so I'll use they, but they talked about like belly liners when it gets hot and we're sweaty. There's just so much more. Oh my gosh, anything to do with chub rub and different types of clothing. Like, it's so helpful to learn these things, and that there are people talking about it more and more, which brings us to what you do in the world, which is that you are a birth doula, which is amazing. So tell us a little bit about yourself.
Yeah. So I'm Christina, use she, her pronouns. I am the founder and co-owner of Big Fat Pregnancy, which is a full spectrum doula services business. We also offer birth mentoring and childbirth ed, where we focus on empowering fat folks to move through their pregnancy, birth, and postpartum with confidence, with education, with evidence-based research, in the body that they have now, right? We are really, really keen on supporting folks in whatever their goals are for birth and postpartum without having to change who they are, without having to morph their body. There's so much pressure on fat folks in fertility, getting pregnant to lose weight in order to be the quote unquote right size, to have a baby. And I won't get into that because that's Nicola Salmon. If you don't follow her for fat positive fertility, that's her area of specialty. So go follow her.
Yeah. And Nicola was on the podcast too. So there's an episode, I'll link to it actually in the show notes. Yeah.
We're gatekeeping, right? Fertility, and we require or request that fat folks change their bodies so much in pregnancy that they don't gain too much weight, that they, stay active, that they do all these things, right? So our goal at BFP is to support fat folks in the body that they have now. And how do we get them through pregnancy, birth, and postpartum in the most, confident, empowered, caring, respectful way that we can, and provide the things that they need to birth, in the body that they have now.
Yeah. Oh my gosh, that's amazing. And we're going to go into like what exactly is a birth doula. We'll talk about all that. But before that, I'm so curious about your journey with the word fat, because I imagine it probably led you to the work that you do. So take us through that.
Yeah. So I would say probably about, oh gosh, it's 2023 now. So probably about 10 or so years ago, I started my journey to eating disorder recovery. And that kind of led me to some anti-diet nutritionists, started getting comfortable with what does it look like to not be on a diet anymore, as many people I'm sure who are listening, who I work with, right? If you're comfortable with the word fat, you usually have gotten to a point where you're like, I'm done with this world. And so, that led to therapy, that led to, some programming, some help, some support to get through that. And in that journey, I found fat liberation, the frameworks of fat liberation, of health at every size, of body liberation, and started kind of just realizing what a crock all of the things that I had believed about my own fat body, right? And then I went to grad school and I was getting my master's in adult education, and I was focusing specifically on education around pregnancy. I'd always kind of been fascinated in birth, but didn't really know where it was going to go. And then I happened to get pregnant in grad school. And so then my entire world became consumed on all things birth. And so those worlds kind of melded. My kind of fat liberation journey melded with my own experience of birth, and then this education piece. And I really just got to a point where I thought, I want to have a baby. I am having this baby, and the world is telling me that I shouldn't be having it in this body. And I got to a point where I just said, no, I'm not gonna let that be my story anymore. And I just got really comfortable with the word fat, seeing it in articles and journals and listening to it. And it just was like, you know what, I'm going to stop being ashamed of this word. I'm going to stop hating this word, right? I am fat. That is a really accurate descriptor of my body. And then once I started calling myself fat, it just became this really kind of almost empowering, positive thing. That took away so much shame and, guilt and self-loathing that I had attached to this stupid little word, right? That was just a descriptor. So yeah, my worlds kind of all collided, and then I just started calling myself fat, and it helped a lot in my pregnancy journey too.
I'm curious. That's exactly what I was wondering, was that this all was happening at the same time. And how did that impact your pregnancy experience?
Yeah, so I was able to use the word fat in a very commanding way, because when I talked to my care providers, I would tell them, when I interviewed care providers specifically, I would tell them, listen, I am a fat person, and I am looking for someone who is not going to try and change that as I move through pregnancy. I am looking for someone who is going to support me without suggesting weight loss, without, fear mongering me about the statistics of my chances of X because of my BMI, right? I'm looking for someone who's going to support me and believe in my body's ability to birth. And I was able to weed out a lot of people very quickly.
What were people's responses? Like when you said that, were people like how did you know they weren't for you?
Mixture of shock, of some just really not believing that I would be calling myself fat and being okay with it. Some folks came outright and said, no, we have a BMI limit at this clinic. We don't support folks over a BMI of 40, of 35, of 33, whatever the cutoffs are. And so it was easy for me to be like, okay, you're not going to be my team. And thankfully I had the privilege of having insurance that covered a variety of providers. I could shop around. I had the time to call people. I had a job that was willing and flexible to let me take time off to interview people, right? Recognizing all of that privilege I hold as a white person who is employed, right? So I got shock, I got dismay, I got, there are risks, so we don't really know how to support you. And then I found my care team, and they were like, yeah, we support, people in all bodies, right? There are some in elevated risks for being heavier, but we don't believe that completely indicates or guarantees that you'll have any of these complications. And I was lucky to have two wonderful, really easy, low risk pregnancies and births. So who knows if that story might have changed, if I encountered some complications along the way, right? My midwives wouldn't have continued to see me if I had gestational diabetes, or if I had a breech baby, I would have had to transfer to an OB, right? So there's lots of things that can come up for fat folks, for anybody really, but for fat folks too, that would risk them out of care down here. So it's a delicate balance. But yeah, finally just was really honest with the care team, and they agreed back that they would care for me in the body I had now, and they did.
Yeah. That's amazing. Oh, I'm so glad you experienced that. And then, so you had midwives. You had a midwife birth. Would I say midwife assisted birth? I don't know the terminology.
I had a home birth. I had 2 home births with a midwife present.
Okay, cool.
And doulas.
Oh, and you had doulas too. I was going to say, because how did you know about birth doulas? Because that's something that's still not super, super well known. So do you want to start there and tell us maybe like what the difference is between a midwife and a doula?
Yeah, you bet. So a doula is a person who is available to provide physical, mental, emotional support to a birthing person and their support partner or partners throughout the process. So traditionally, it includes several prenatal appointments to get to know folks, continuous assistance throughout the entire birth, immediate postpartum support, and then sometimes additional postpartum support, depending on what the family wants. So a doula is really meant to help you hold space for you to make decisions, provide comfort measures and techniques to help you get through labor, keep you grounded, create a calm environment, support your partner, and then help kind of digest language that you may not understand from care providers.
It feels like it's very much about the birthing person as opposed to perhaps more medical environment, which would be around like often the baby first kind of thing. Okay. Yeah.
So midwives are there to secure the medical safety of the health and wellness of the birthing person and their child. So they're really focused on, the actual act of labor progressing, the actual act of birth, right? They do obviously prenatal checks as well, right? They're going to check baby to make sure everything's going well, check in on the parent. But it's really focused, directly on the health. Midwives in the States sometimes will also expand that to the kind of holistic care of social, emotional, mental well-being as well. But yeah, doulas are really focused on kind of that physical, mental, emotional support throughout labor and postpartum. And midwives and OBs, obstetricians are also focused on the medical side of things. So doulas are not licensed. Doulas in the United States don't have any sort of professional requirement to call themselves doulas. There are licensing agencies, but it's not a regulated field. Whereas obviously there are very strict regulations for midwives and OBs in the States.
That's interesting. That's similar to coaching. Like therapy, if you're a therapist, it's like deeply regulated. Coaching, I'm curious. I'm just going to ask because I know in the coaching world, this is one of the challenges is that anyone can call themselves a coach. And therefore you get a lot of people who just decide one day to be coaches and they are not trained and things do not go well. So is it the same with doulas? Yeah. Okay.
Yeah, anyone can call themselves a doula. Like I said, there are accrediting bodies, there are organizations that certify you as a doula and provide some sort of certificate. But in the grand scheme of things, like it doesn't really mean anything because they're not like federally regulated or, there's no oversight. But again, that also leads into like questions around what legitimizes a certification, what legitimizes a profession, right? And most of the organizations subscribe to or in some way, uphold white supremacy and hierarchy, right? And so lots of people will not certify because they don't believe in those things, not because they don't believe in the value of being educated as a doula. So you'll find quite a variety of, opinions, of training, of, educating ourselves in this world. But
yeah. So what should people look for then if they're wanting to hire a doula? What are some of the questions maybe it's like, what questions should they ask themselves first?
Yeah, I mean, I think, while we're on the topic of certification, right, asking yourself if that does really matter to you, because there are definitely ways that you can find out, if people are certified. The biggest body down here is DONA. That's one of the biggest accrediting bodies. Some folks are really adamant that people have X years of training, X years of X number of births, X certificates. So asking yourself what makes you feel the most comfortable. Is it a piece of paper saying that they're certified, or is it, your encounter with them? Is it your vibe? Is it, how you connect with the person, their, anecdotal stories of past births, your trust in that person, right? You're inviting someone into a very intimate part, intimate and vulnerable thing. So making sure you're comfortable with them, right? I think would be first and foremost that you feel like they're going to trust your body, your autonomy, your decision making, right? That they're going to add to your experience, not detract from it. So asking yourself what's the thing you value the most in your birth experience, I think is probably going to give you the best start in finding someone who clicks with you.
Yeah, beautifully said. So when did you decide to start Big Fat Pregnancy? What led to the creation of this?
Yeah, so I would say 2020, end of 2019, 2020, right before the pandemic hit, I had finished my graduate program and I was like, okay, I'm going to teach people about childbirth, because most of the childbirth classes down here are very sit and get, and they're just kind of, I would say they're somewhat educational, but they don't include principles of adult learning. They don't include the parents to be, the family to be. Some of them are not very inclusive to different family structures, to fat bodies, to, non-binary folks, trans folks, right? There can be a lot of exclusion. I live in close to Seattle, Washington. So we have, I would say, a lot of really great childbirth education classes, but I was like, I'm going to get in this. I'm going to teach folks in an adult education way. This is going to be great. And then the pandemic hit and I was like, okay, maybe not the greatest time for me to start in-person business.
Yeah. And how you had just had your first child?
Yeah, I started in 2020. My first child was about 9 months old.
Okay. Yeah. So oh my gosh. So pandemic hit.
Yeah. And so I was like, okay, I'm going to take a beat. Like I need to pause. This is maybe not what I want to do right now. So I started Big Fat Pregnancy as like an Instagram account, just like I can educate people without having to have classes. My personal life, I had found a job I really liked. I was like, okay, we'll just do this as a hobby. So I started posting content just about being fat and pregnant, resources, videos. I started doing provider workshops. So how to be more fat positive if you're like a chiropractor, a massage therapist, a midwife. And then it kind of morphed into, no, I want to be in this space. I really do. So as the pandemic loomed and didn't seem to have an end in sight, I thought, okay, this can't stop me. People are still having babies. Like we got to figure this out. So then I did go through a doula training, birth advocacy, doula trainings, and started seeing clients in the last year. So
wow. And how's it been? What's the learning curve been like?
It's great. So alongside a doula, another part of our business is that Big Fat Pregnancy also offers what we call birth mentoring, which is coaching basically for fat folks who are either trying to get pregnant, who are going through pregnancy, who just need support with like, okay, my doctor said this, and I don't even know where to start in order to talk to them about something, or my family member is doing this really gross fat phobic thing, and I need some support, like talking through it. So a lot of my work in the beginning was just virtual appointments, individually talking to folks dealing with these situations as they came up in pregnancy. And that kind of turned into like long-term coaching, like with people throughout their pregnancy, kind of guiding them through, these are the questions we can ask. Let's do some birth planning. So that learning curve alongside the doula world really helped me get an insight into what my clients were facing from their providers and their family members and the external world, as fat people getting pregnant, and then coupling that with the birth experience. There's no birth that is the same, even if the mechanics of it are the same. And so I think I'm constantly learning. I'm constantly discovering new ways to physically support clients, with different comfort measures, with different tools that are adapted for fat bodies.
That's a big one.
Yeah. Yeah. So a lot of times, as a tangent, a lot of times the equipment that folks have in a birthing suite or in a hospital aren't adapted for folks over a certain weight. It's usually pretty low, like 250 pounds, and that doesn't really encompass a lot of folks. So my partner and I, Emily, we bring our own kind of toolkit with us to births. So we have a birthing stool that goes up to 750 pounds. We have some rebozo type material. It's a traditional Mexican cloth and way of working with someone to support them during pregnancy for comfort measures. So we have one that is specifically like designed for extra weight. And we do a lot of positioning that is different for people in fat bodies. So if you've ever seen like a sheet of, pregnancy positions, a lot of them are really inaccessible to people who are fat, people who have chronic illness, people who have connective tissue disorders, people who have any sort of chronic pain. There's a lot of them like on all fours. And so we bring like knee pads, because kneeling on a hard floor while you're pregnant, right? So it's just things like that. We're trying to always think about how can we modify the environment that someone's giving birth in to make it more comfortable, because when you're more comfortable and you have less physical pain, you're not focusing on that as much, and you can work on moving through contractions and getting that oxytocin flowing to help you with the delivery of your baby, versus focusing on a pain that's not even connected to your birth. That's what we're trying to eliminate.
Yeah, birth doesn't need more pain.
No, yeah, it doesn't need to distract you, right? Yeah. So
it's so interesting. Until what you just said, I've never thought about. And of course it makes sense. Why have I not thought about this? But the different positions, because, when you watch birth on like a movie or something, I've always wondered, I'm like, how are their knees up by their ears? And like, you've got the nurse on one side and the partner on the other side, and they're pulling the legs back. I'm like, that my body could not do that. I have a bad knee from a skiing accident, and like, I couldn't be on all fours in that way. And like, it's so interesting. On one hand, Christina, I'm like, this is such common sense. And on the other hand, I'm like, but no one's doing it. Like, it's really still, why am I still shocked? Why am I still shocked that we don't think about fat bodies?
But yeah, right. And that's what, Emily and I do, right, is that we work to, we work obviously from a consent framework. So we always ask permission before touching, before helping folks move, right? But we're not afraid to touch fat bodies, right? Like, we're not afraid to get in there. Like, if I have to lift up your belly fold in order to help you move your knee to be in the right position that's comfortable for you, like, I'm going to do it. I'm going to hang on to your chub, and we're going to get right? Like, so I want people to know that that's also a huge part of it, is like being comfortable with someone touching your body and making sure that they're comfortable touching your body. That's another one you could add to the doula list, right? Because I also know, as someone who lives in a fat body and gave birth to both babies well over 300 pounds, right? I know what it physically feels like in my fat body to not be comfortable because I couldn't find a comfortable position and I needed someone else to help me, right? I needed someone else to be there to support me. And knowing that the people who were in my birth area were comfortable touching my body and weren't, I wasn't worried about them secretly being repulsed or judging me, right? Like, I was like, okay, these people love me and they're here for me. They're here for my baby, right? And that made a complete difference in my ability to be comfortable. So that's what we hope to give our clients, is just that confidence in knowing that like their body is perfect the way it is. And we value that, and we believe in their ability to birth, in that body they have now, chub, no chub, disabled, not disabled, right? We are there for our folks to try and make it as enjoyable as an experience as possible, because birth can be enjoyable, can be wonderful. And we want to make sure that there's no external fat phobic or systemic fat phobia that is making that unattainable for our clients.
Oh God,
or
bless
reduce
you.
it as much as possible.
Right? Like, I'm just like, oh, bless you for that. I'm like, can I get a doula for every medical appointment I go to? And like,
That's actually something we do. We go to appointments with clients if they need us to. I'll FaceTime in for clients, because just having a third person there who knows about the medical system can make a huge difference in the way that fat people are treated when they have those appointments. Even just recording them, even just saying, hey, you know what, I'm going to record this conversation because I have a hard time remembering, things, or I do better listening to stuff back, that will even change how providers talk to you. Unfortunately,
when they know, it's true. When they know they're going to be held accountable for their words. Cause that was my, as soon as you were talking, I was like, oh, I'm so curious about you being in conflict, or not you maybe, but like diet culture showing up, all the bullshit around, medical stuff around fat bodies, and there being a conflict between perhaps your client's values and how they want to live and what they're hearing from their doctor and what they're saying. So how does that work?
That happens all the time, unfortunately. That's why I still have a job. I hope one day that I don't need to be, focused on this. But I think one of the clearest examples I can think of is, around the topic of gaining weight in pregnancy, right? A lot of my clients will be told that there's a very specific number of pounds that they need to make sure that they stay within, right? And a lot of my clients aren't even weighing themselves, right? Because that's harmful for them, or they've just not something they do ever or anymore, right? And so for them to be told that there's a specific weight that they have to stay within, it's really difficult. A lot of my clients will advocate for, I don't want to be weighed, right? Like, weight is not something that I need to know. And you can do that either by not seeing the scale directly. You can ask to turn around, you can ask not to be weighed. But if you're going the traditional path of an obstetrician, connected to a hospital system, it's pretty hard. It's pretty hard to get around that. They are really, really dead set on weighing you. So it takes a lot of pushback. It takes a lot of, specific conversations around, there are other ways to measure my health, and I'd like to focus on those. During my pregnancy, they say, well, we have to weigh you in order to make sure that we know the baby's growing. Well, there's other ways to do that. We can measure fundal height, which is the distance from the top of your uterus, bottom of your uterus, I can never remember, down to your pubic bone, right? And we can see growth that way. We can listen to baby. Obviously, we have growth scans, which that's another conversation. But, I think that it takes a lot of follow-up and a lot of advocacy and a lot of providing our own research, which sucks, because it should just be, hey, I don't like this, please don't do it. And that should be the end of the conversation, but it's not. We have to come back usually with resources and, sometimes therapist notes, saying this is detrimental to my health. So, there's a lot that we can do to push back. And then some providers are like, yeah, that's fine, I don't ever weigh my clients. And you're like, great, okay, conversation over. But yeah, that specific pregnancy weight gain is a really big topic for my clients. One of my favorite facts that I love is that also infuriates me, is that the recommended weight gain for fat folks during pregnancy is not enough to support the basic, life-giving, human creating weight. So what I mean by that is, if you total up placenta, the fact that your blood doubles in volume, the weight of the baby itself, the weight you do need to gain in order to adequately feed your body, it is 10 to 15 pounds heavier at minimum than the recommendation from the American College of Gynecology. Yeah. So that one alone gets me quite animated.
Oh, I had a friend, one of my few fat friends that I've had locally. I now have, international fat friends, but locally, who I was close with as she went through her pregnancy. I remember, it's funny, it's years now, maybe 7 years ago or so, but I remember her telling me that this is before either of us had kind of found fat liberation. And we were having lunch and she was so happy. She goes, I just came from my doctor's appointment and I'm so glad because I haven't gained a pound. And she was probably about halfway through her pregnancy at this point when there was, I would imagine, kind of quote unquote, supposed to be a lot of weight gain, because her doctor had told her, you don't get to gain a single pound in your pregnancy. And so she got good patient pat on the head, good fat person. And I remember sitting there going, I didn't really question it too much because I was like, well, I guess this is just what happens if we're fat is we don't get to gain weight, which means then that they're actively losing weight during pregnancy. But I remember thinking, is that okay?
No, super unethical.
Hello, it's Sophia. And I'm gently interrupting myself to let you know that I secretly recorded video content with almost all of the first 55 guests of the Fat Joy podcast. And I'm releasing it to anyone who becomes a subscriber to my new Substack newsletter. So you want to know what each guest is scared of, or what they'd put on a billboard, or what they'd tell their younger self? Become a subscriber of the newsletter at fatjoy.substack.com, and you can find out. You can become a subscriber for free, and if you'd like to help me keep making the podcast, you can become a paid subscriber for $5 a month. You're going to get access to the bonus videos either way, but paid subscribers will be getting additional bonus content on top of those videos. However you choose to become a subscriber, please know how grateful I am that you're here and supporting, bringing more fat joy into the world. Okay, back to the episode. Enjoy. Right. But this is like, this was this is the messaging that fat people get.
Yeah. I mean, I can't tell you the number of clients that I've had who have had, either severe nausea or, vomiting because of pregnancy, right? For either short or extended periods of time, who as a result lost weight and were congratulated on that weight loss when the root of it was so damaging, right? Like they needed to be helped. They needed anti-nausea medication. They needed, right? They needed support with what kind of foods maybe would help settle their stomach, with when to eat, to try and mitigate that, right? To what pairings could help mitigate that. And instead they were given no questions about what's going on. Just, oh, good job losing weight. And then move on, right? So,
and it feels like such an extra vulnerable time for power dynamics to come into play because, of course, people are worried about the health of their baby. And so that is the ultimate carrot for whatever, or power structure, right? Because of course you're like, I will do whatever it takes to take care of my child.
And unfortunately, we see that. We see providers use that in order to get what they want, or what the hospital policy, quote unquote policy, which is really just preference, right? It's not law. There's nothing that says hospital policy is law, right?
You're right. We do treat it as law, though. Oh my God, you're making me think of so many things.
Yeah. But yeah, often, providers will say, well, if you don't have, not often, I shouldn't say often. For my clients, it's often because they're in these situations. But, if you don't have an induction by this amount of time, you double your risk of stillbirth. And it's like, well, but what you're not, because you're fat, right? Because you're fat. Well, what you're neglecting to mention is that the risk of stillbirth goes from 0.01 to 0.02%.
Oh my gosh. Is it?
Yeah, it's really low. I don't know if those are the exact numbers, point zero something. And it doubles. Yes, they are correct. It doubles, but it's still an incredibly small number. And that number does go up by BMI category, right? We do acknowledge that. But we also don't know why. Because no research study takes into consideration all of the factors could be influencing, right? They don't look at socioeconomic status. They don't look at access. They don't look at racism in the medical system, right? There's a lot of things that they're not factoring in to get those statistics. Yeah. And so we fearmonger fat folks often into having procedures or inducing or interventions without giving them the full range of options. And this happens for straight size folks too, right? We're given the what happens if you don't do this? But we're not given the alternatives. We're not given, okay, well, what happens if I wait? what happens if I do nothing? What happens, we aren't given the benefits and risks of all options on the table. And to me, that's not informed consent. Folks are not able to accurately and adequately make decisions about the health of their baby and themselves if they're not given all of the options.
Right. And so if you're there as a doula in your role, you would say, and here's some other things to think about. Like, what do you do in that?
Yeah, it depends on the situation, right? If we're in like a appointment, right? I will, usually when I establish care with a client, we will come up with a code word or a code look or something that they can shoot me quickly if they need me to step in or if they want me to step in, if they're not comfortable doing it themselves. I have lots of clients who want to advocate for themselves, who just want, my background support. And then I have other clients who aren't comfortable, right? So it depends on what we've established, but if it is a client who wants me to step in and they've said the code word or given me the look, right? Then it's usually I try and do it in a very collaborative way of like, oh, and also, I've read this research that I just read, right? Whatever can gently broach the subject, says this. Can you talk about the options and risks, right, for this? Sometimes in labor and delivery, it has to be a bit more forceful because laboring person might be completely focused on laboring, and their support person might be like, I don't remember. I don't know what to do. Right. And so then providing them information can be helpful. And sometimes it's as simple as, hey, doctor, can you give my clients 5 minutes to discuss this in private? Right. Sometimes it's just pausing. I would say that pregnancy, labor and delivery, we often use time as a weapon, right? We have to make this decision right now. Baby needs to get out, right? When in reality, the actual occurrence of true emergent C-sections, right? True emergencies in birth is a lot lower than we think because we're often told that it's like you need to make a decision when most of the time we have 2 to 5 minutes to talk about it, to come up with questions, right? The Western medical system is amazing, right? It exists for a reason. We need emergent care sometimes. We need these life-saving options. But when folks aren't given the full spectrum of options and not given the time to think about it, it's, like I said, it's really not informed consent.
No, and that starts to play into power dynamics. And I imagine there's a lot of things related to bias and racism and all these types of things that start to show up.
Yeah, because we make assumptions about someone's ability, their physical ability, their mental ability to comprehend things, their, based on what they look like or, what they've presented to us throughout pregnancy, right? Of course, they're making snap judgments. They're making judgments based on what they feel is their professional expertise. But over time, I do believe that, right, it can be clouded. We can get jaded. We can get, pulled into the system, the medical industrial complex, right? Where we stop questioning these things. We stop looking at our patients as individuals. And case in point, oftentimes in the hospital, they'll refer to you as your room number and not your name, because they're humanizing to compartmentalize and to, see you as part of the system. So, and that seems like a bleak outlook, but, I think that this is not all providers, obviously, but, when we talk about the cases where my clients are really encountering that pushback, right? It's because of that power. I am the doctor. You will do what I say. I believe this about your fat body. So I believe that my clients should at least have the chance to ask their questions and to move through the decision-making process in a way that makes them feel cared for and respected. Because at the end of the day, even if we have interventions, even if we have birth plans that don't go our way, if we feel cared for and respected in our ability to make our own decisions, then it still can be looked at as a positive experience, even when things don't go our way.
Yeah, absolutely.
Berta Bushnell talks a lot about that in Transformed by Birth. I think that's the title. But it's a great read for new parents, parents to be. It talks a lot about the kind of conflicts of our belief systems, between like, Mother Nature. She uses storytelling a lot. Mother Nature, like our Western views of, medicine. So it talks a lot about that conflict, and slowing things down is one of the number one ways a doula can intervene.
Yeah. Can I ask a gossipy question? Because I'm just dying to know. Have you had to because I know a lot of doctors and I know a lot of doctor egos. Like, have you had to really go up against, as in maybe even be no, yell at doctors?
No, thankfully not. I have not, but I know other doulas who have. And I know,
because I can just imagine that.
Yeah, it can get tense. There are definite times when I've had doulas say, I've heard doula stories of no, you need to leave the room now, right? No, we're not doing this right now. But I would say, thankfully, I feel like the environment around here is a little bit more collaborative. But again, I'm not in every birth, and I don't know every doula. So, I'm sure there are definite examples of that for sure. But
I want a movie made about doula experiences. I just imagine them as champions for the marginalized,
Yeah, it depends. I would say that's one of the biggest, areas for work in the field of doula, as most fields, right? Is that many folks believe that a doula's job is to help advocate on the behalf of their patients. And many doulas believe that that's not their job, that they're just there to support the birthing person physically, or, emotionally, but that doesn't mean stepping in on their behalf. Which is why we try at Big Fat Pregnancy to be really clear that we believe in advocacy on behalf of our client, if that's something they're comfortable with, and if they agree to us doing it for them, right? I'm never going to step in if my client's no, I don't want you, right? I'm not going to be that, but there are instances where I will look at my client and I will be something needs to be said, right? And they'll kind of give me permission to move forward. And it's hard to detangle your own emotions.
I was just thinking right now, I would be a terrible doula. I'd be no, I don't care what you say.
It takes a lot of practice, but right, I am there for my client, right? I am not there to fight the doctor. I'm not there to fight my own fight. I'm not there to make things harder for my client, right? So sometimes that does mean collaboration, even when you're biting your tongue, right? Sometimes that does mean you see things happen and you're oh God, it just gets under your skin, but your client is fine with it, right? And so that also comes into play of I have to respect the wishes of my clients, even if that means sometimes I would want to say something, but maybe they wouldn't. And it also can happen where they want to say something and I don't, right? Because I am a fat person who still struggles with internalized fat phobia, and the power dynamics of the doctor still get to me, right? So there's a lot of work that, I do as a doula personally to reflect and to continue self-work to make sure that I can, show up for my clients in that way. Because it's hard. It's hard as a fellow fat person in the room. But I think that is also the strength of our, practice, and the strength of what helps my clients through is that it is a fellow fat person next to them saying, no, this person demands to be treated with respect. And I'm a fat person and I'm going to stand up to you, right? There's some power in that, empowerment in that as well.
So well said. You had mentioned that you also work quite a bit with disabled and queer pregnancies as well.
Yeah. Somehow our identity of being fat has also overlapped with queer folks and with disabled folks, specifically having folks with, connective tissue disorders or hypermobility or just physical limitations, some folks who are chronically ill. So a lot of my birth mentoring is working with folks and talking them through, different testing options, different procedures, different, again, movement, options, to make sure that they can physically, be comfortable and be respected. And right, we're multifaceted people. We hold many identities at once. So none of my clients are just fat, right? Usually there's a multitude of other identities that we carry through. So yeah, just trying to be really respectful of how a person needs to be treated. Specifically, there's a lot of correcting of pronouns. There's a lot of trying to make sure that we're not, solely going with the mama and breastfeeding and, options that don't always fit my clients. So being really clear about that. I have pronoun pins that I usually provide for clients if they want them. We can put signs on the door that, has pictures and names and pronouns. We can remind folks what's going on. We try and use inclusive language around our providers so that they, we can set the example that they know how our clients, prefer to be referred to. And then, we're learning so much about the dynamics between queer folks, between infertility, between the intersections of fatness, the intersections of racism. So it's just a constant learning process for us to make sure that we are educated so that we can support and advocate, for our clients.
Yeah. Wow. Even just you saying there are pronoun name or pronoun pins, and I can put things on the door so the healthcare providers know, like that, again, this is one of those seemingly really simple things that has a huge, huge impact on how a patient would feel, how someone would feel.
Being constantly misgendered over the course of 10 to 30 hours, right? That doesn't feel good. And so, right, yeah, it's simple things that we can do to, try and make it a little bit easier for our clients. And, constantly we have folks who are, queer, specifically if they're both women, and the nurses may assume that the partner is just a friend, right? And so they'll say, "Oh, mama, what do you want? Mama, what do you want?" And it's like, well, also there's another person in the room who's very integral to the support of this person. So, establishing what these people mean to each other, right? Making sure that the birthing partner is included, or partners. Sometimes we have more than one, right? Family structures don't have to be a mom and a dad, right? And it's crazy to me how I still encounter that, right? That is still the baseline assumption. And so doing everything we can to make sure that people know that, there's a variety of family structures, a variety of preferred terminology for body parts. There's lots of ways we can model that for providers. Sometimes they catch on, and sometimes they don't. Sometimes we have to be more explicit of, excuse me, they use they, them pronouns, or excuse me, they don't want any males present in the room, or, whatever the case may be, whatever makes a family more comfortable.
Yeah, right. Wow. It's so interesting. And that you do all of this, especially if it's in kind of the labor and delivery process itself, the active labor, you do this in such a chaotic environment.
Yeah. Sometimes birth can be really calm and wonderful. And we don't,
Why don't we see that? I don't know if I've ever seen a calm.
Because it's not how it's portrayed in the media. So yeah, and that's, I do a lot of work with clients around the mental preparation for birth, that we don't have to be afraid of birth, right? We don't have to be afraid of the process. It doesn't have to be this horrible, painful, traumatic thing that is portrayed in 99% of media, right? We can have very enjoyable experiences. Will there be pain and discomfort? Likely. I don't know many people who've gone through the process who wouldn't say that there was some discomfort or pain. But when we reimagine that pain has purpose, and that we are prepared, right? We are mentally, physically prepared to do this, right? We are capable of doing this. When you truly believe that, I think it changes the whole experience. It can change the whole experience. And there's nothing wrong with all of the wonderful, lovely pain interventions, if you do need them, if you do choose them, that's totally okay too. But even with or without unmedicated, medicated, pelvic birth, cesarean, we can still impact the environment to be the most conducive to an enjoyable experience, even if things don't go, quote unquote, according to plan, right? But in birth, they rarely do. So, usually we focus on dim lighting, soft voices, comfortable clothes, comfortable blankets. For my plus size clients, there's a lot of discomfort in the continuous fetal monitoring. So it's usually 2 bands that have this big disc and then wires, and they're usually attached around the belly. And so this is so we can get a continuous heart rate and monitoring of baby. They're not made for fat people. They're really uncomfortable. They're really tight. even the largest sizes can be really constricting, and they can pinch and they slip up, they slip down. People are constantly having to fiddle with them. There's beeping, right? So if possible, I suggest for a lot of my clients, if they can have not continuous monitoring, if they can have a Doppler, or it's an instrument they use to hear the baby's heart rate, just not all the time. That can really help. There's also a specific type of monitoring system. Of course, I forget the name right now. Navira or something like that. I'll get it for you. But it's a wireless continuous monitoring system that just sits on the front of the belly, and it's attached by tape. It's waterproof. It can go in the shower. It can go in the tub. And most hospitals can provide it. They just don't. So, there's things that we can also ask for to make that environment more comfortable. So yeah, that's what we try to achieve, and we never see that portrayed. Or we see the opposite, which is funny because I have my lights up still, but like twinkle lights and like dark, and someone leaning over a tub and like totally serene, right? We either see either or, and it's rarely all or nothing, either way, the screaming stir up, on their back, or this sincere picture of calm. It's rarely ever both of those. Or only those, right? It spans the continuum, like everything else in our life. It's a spectrum, right? So
totally. Oh, I love that. Yeah, I think I remember of my former sister-in-law. So from a previous marriage, I remember her saying, I was talking to her about her birth, and she said, I just had this moment. She did a home birth in a tub. And she said, I just had this moment where I realized I am not in control anymore. And she said, I just surrendered to my body being the animal it needed to be in that moment. And I had never heard, this is probably like 15 years ago now, and I had never heard anything like that before. And I was just like, you are like so like zen above me right now. Like it was just, I thought, never. And it was so cool to know that was an alternative or another way of birthing. So at that point I hadn't seen anything other than the screaming emergency kind of situation. So, yeah.
And it can be, right? It can be that. And what I do a lot of, when I talk to my clients, one of the things we talk about is, that mental preparation, right? Because we do have to do some preparation, because surrendering, right, is for some the goal, right? Like that's what allows them to get through the hardest, most difficult, most intense parts of childbirth. But if we think about that act alone, right, that's a privileged thing to be able to do. If you have body trauma, if you are not comfortable in your own body, if you are disabled and maybe don't have a physical connection to every part of your body, right? If you have mental blocks around connecting with your body, right? Birth can be very triggering, right? And the physical sensations of birth can be very re-triggering for people who've experienced trauma. And so thinking about, yes, that is the goal, right? I would describe that both of my births, I would describe them like you just described them, but that's not accessible for everybody. So we need to figure out a way for our clients to get there as much as they can, but in a way that's comfortable for them, right? Do we achieve that all the time? No, but being aware of trying to create a trusting relationship with our clients so they can talk to us about that kind of stuff, so we know what might come up. One of the biggest things is that the act of transitioning, which is when baby goes from descending down pelvis to actually getting ready to, come out. It's one of the most intense periods of childbirth for all people. I would say would describe that as the most intense.
Intense because of like feeling like it feels intense?
I would say, yeah, it depends on the person. Some people describe it as painful, intense, lots of pressure, right? But the physical sensation, the act of transitioning for a lot of people can be a triggering feeling, a triggering body feeling. So if we know that a client has had past, experiences, any sort of sexual assault, any sort of, stuff like that, we can talk about that ahead of time. And we can talk about like, this may be a part in birth where it is very difficult for you to be out of your body. And so let's talk about affirmations. Let's talk about, guided meditations if you're into that thing. Let's talk about journaling. Let's talk about birth art. Let's talk about something to kind of prepare your mind for that transition and that act of birth. So if we know those things about our clients, if we've created a relationship where they feel comfortable sharing, we can help folks, be aware that these body sensations might prohibit them from getting to that surrendering part if they're not aware of what's coming, And it's hard if you've never done it before. It's like, how do I know what it's going to feel like, right? So yeah, someone who's aware of that can be really helpful. Or even in the moment, if they're like, I'm being triggered or something's happening and I don't like it, right? The hope of a doula is to be there, to either support their partner or partners if they're supporting them, through it, or to be able to provide some sort of comforting touch or statement or something that helps bring them back to, no, we're not in that moment, we're here, right?
Right. You've got me thinking so much about safety as kind of a baseline for so much of this. Like as someone myself, so I've been pregnant, but I've never given birth. I had a miscarriage and I've also had an abortion. And and now as I'm going through different gynecological processes and tests because of endometriosis, I'm so aware every time I get I'm now kind of used to the whole transvaginal ultrasound, but in a couple of weeks I've got to go in for one of those things where they're going to go into my uterus and scrape the cells to make sure I don't have cancer. And I've had it done before and it was horrible, and it brought back a lot of the trauma connected to when I had an abortion. And it was just I'm just thinking about that, and then I'm like, oh my God, how would I be able to hold all of that if I and going through a birth process, which I'm now very past. I'm not, I'm way too old and not interested in having my own child at this point. But I'm just, when you said that moment of transition, I could feel, even just you saying that, I could feel my whole body start to be oh my God. And and I'm very much at a distance from it. And so, yeah, the amount of, I think what I'm trying to say very inarticulately is I'm really feeling in this moment what a gift it would be to have someone who can be with, if it was me, be with me in all of my past rushing into the present, being freaked out, all the uncertainty, all the unsafety, on top of let's bring in the systemic oppression of living in a marginalized body and people in the room who probably actively disdain who I am. There's just so much fucking happening, Christina.
Yeah.
Oh my God. I'm getting stressed out as I'm talking about it. I'm
there can be a lot going on, right? And that's where we work really hard to understand, pre-birth, what gives you, what helps you feel, what helps you feel grounded, what does your partner do that supports you, that helps you feel that way, right? Because then we, as the person who's not actively experiencing the birth, can remind them.
Yeah, because in the moment, I imagine it would just be gone.
Yeah, what we call it labor land, and it's a certain part in labor where you do really go inward, right? You can't really focus on anything that's going on around you. And studies have shown that when the chemicals that are firing in our brain and our bodies during this time, when we experience labor land, we do actually lose some connection to speech and processing, right? The chemical is not you're not going to be able to speak. I don't want to freak people out, but the chemicals in our brain and our bodies are so focused on the act of getting this baby out that we are not functioning at a level where making super intense decisions quickly or communicating all of our needs effectively, right, are going to be the most available to us. So having people around us who know what those needs and desires are to begin with helps the process so much.
Oh, I love it so much. I want a life doula. I can just imagine, right now, my life doula would come and massage my shoulders.
Yeah, right. Hey, it's helpful in all sorts of situations. I've used my doula skills across the spectrum of conflict, and
I can imagine. That's amazing. Wow. Oh, the work you do is so cool. I'm so glad to talk to you about this because I didn't really know much. I knew about midwives, but I didn't really know that much about birth doulas. This is so fascinating. I'm curious about, and we talked a little bit on this, and this definitely, I'm going to link to Nicholas Salmon's episode because we touched on this a little bit, but the other part of this, and what I really love about how you're saying things and how you've built your practice and positioned your business is that it really is taking into account the impact of marginalization, the barriers, the systemic barriers to healthcare. And one of the things that we've talked about is this idea as when fat people are refused care, such as being able to go through IVF, it's a form of eugenics. And I want you to just wax poetic for a second on this, because I don't think we can overstate just the horror that this is, the body terrorism that this is. So yeah, share a little bit about that.
Yeah, I mean, I 100% agree. I mean, in the States, we have fertility clinics who will deny care to folks who will not help people get pregnant if they are over a certain BMI. Sometimes it's 35, sometimes it's 40, sometimes it's 42, but whatever the limit is, it's still a limit. And we're still saying, no, we don't think you should have a baby.
And it's based on BMI, which we know is bullshit and trash. And that's been proven a million zillion times. And yet that's still okay.
Yeah. And yeah, so it is, right? The healthcare system is choosing who gets to be pregnant and who doesn't, right? And also, right, it plays in, I won't get into this, but it plays into our current conversations about abortions in the state, right? Like, we are choosing who has the right and who doesn't have the right to continue or abort a pregnancy, right? And so it's dangerous, and people make so little of a deal out of it, and it blows my mind. We also have the same similar processes in midwifery care here in the States. Individual midwifery clinics can choose to limit who they take on as clients based on BMI. So they can refuse service based on BMI. And this means that a fat person would have to seek services from an obstetrician or in a hospital setting, because in the States, we don't have obstetricians who do home births. We don't have anything in the medical system that will allow folks to birth outside of the home with a provider unless they have a midwife. We have what are called licensed midwives down here. So we have midwives who practice out of hospital. They can be certified professional midwives or licensed midwives, and they practice out of hospital at freestanding birth centers or attending home births. And then we have certified professional midwives who operate inside of hospitals attached to hospital systems. So those are attached birthing centers or just midwifery units within hospitals. So if you cannot find an LM or a CPM who will do a home birth because of your BMI, your choices are an obstetrician or what we call an unassisted birth or a free birth, which is where folks can choose to birth at home or a place where they feel safe without a care provider present, right? So we are basically saying that you need to enter a system which you know will be dangerous, which has harmed you in the past, which will cause you many, many months and months of anxiety, if not harm and trauma afterwards. Or you can choose to birth at home without a care provider, which you may not be comfortable with. You may be comfortable with, but chances are you don't really want that as your first option. But it's better for some folks than dealing with the harm and trauma of laboring with a doctor. Yeah. So yeah, it's choosing who gets to birth, how we get to birth, and yeah, where we feel safe is not taken into consideration, and that's pretty shitty.
No. And I still can't get over, again, I don't know why I'm so stuck on it and surprised by it, but that it's all based on BMI. I mean, it's not even like, hey, we did some blood work, we've got some concerns, like nothing. It's like straight up BMI, which is nothing. It tells us nothing about people.
Yep. And there are some midwives who obviously, won't have a BMI limit, but their practices or their threshold for risking clients out, which means they then would be transferred to they'd have to find an obstetrician that also removes them from the care of where they may feel safest or where they may be safest based on factors that may not be as explicitly fat phobic as BMI, but have underlying, tones of that. So yeah, so it sucks because my experience could have been very different had I had complications or things that arose. And I mean, I guess I almost did risk out of care. My daughter was breech for a very long time, which means that her feet were down instead of her head down. In the States, we have almost virtually no providers who will deliver feet down. They automatically consider it a C-section. And so, I had to do several things in order to try and get her to turn around so I could have a home birth. Thankfully, we got there. But if I wouldn't have, I would have had to automatically had a C-section, right? And then I would have been, subject to all of the rules and regulations and fighting for in a hospital system.
Yeah. Wow.
A lot of work to be done.
There is. I get overwhelmed by it. Do you get overwhelmed by it?
Yeah, I mean, definitely. I think as a fat person who lives every day as a fat person, still encountering systems. I'm not in the birth world myself personally anymore, having children, but I'm in the medical system. And, just the other day, I went to a doctor's appointment and they, did their normal check. And at this point, I don't choose to not be weighed anymore because it's just too much of a fight in my medical system. And I don't care anymore. So for me, it's not that big of a deal. But the first thing the doctor said when I got into the room after the initial height, check, all that fun stuff, was, "Oh, congratulations on your weight loss."
Oh my God. And not a single question like, "Hey, what's been going on? Are you stressed? Are you sick? Is there anything happening?"
Yeah. So it's a prime example of we still deal with it every day, whether we're birthing or not. And it does get overwhelming. And my clients give me so much hope and so much joy seeing folks who maybe without this fat liberation framework, without this realization that, all of these things are based in racism and white supremacy and sizeism and ableism and sexism, right? All the isms, right? That they are a wonderful human being and they have value and they're worthy, right? Seeing my clients go through that process and then in the end, have this little human that is going to be taught these things going forward, right? Where they're breaking this cycle for their baby, right? For the generation to come. That gives me a lot of hope. And I see my kids too. And I'm like, my daughter will run up to me and say, "Mama, I love your fat belly." And she'll rub her face in it, right? And it's like, I can't ever have thought of a time when I would have done that to my mom, right? So, those kinds of things give me hope when I see fat parents rejoicing in their fatness, loving their bodies or accepting their bodies and moving into this space where they, have a family. And I think everyone should have the option if they want to, to have that. And the fact that we are still controlling that definitely makes me very, very sad. But I also have so much hope. So I hold both at the same time. There's a lot of problems. The system's really messed up, and there's a lot of great people and organizations out there who are trying to change it every day.
Yeah. Oh, amazing. Well, and that's the perfect way to move into joy. So in addition to what you just shared, what does connect you to joy? Do you feel, I'm starting to get really curious about this with people, do you feel like joy is a choice?
Oh, that's a good question. I mean, yeah, I think so. I think anything we feel is a choice. Not to say that if you don't choose it, it's not okay. But, I do think joy is a choice. I think it's okay to not be joyful, right? I see both sides, but yeah, I find joy in my children a lot these days. My husband is currently pretty sick and been in the hospital since January, and and so my children bring me so much joy these days. They're 4 and 15 months, and they just are discovering everything about the world all at once. And so they seeing their little eyes light up at, the silliest of things is a big light in my day right now.
Oh, that's amazing. Well, Christina, you've brought me so much joy. I feel like I've learned so much from you during this conversation.
Thank you so much. I love talking about birth. I'm so happy to be here. I really appreciate all your prompting questions, and thinking about this stuff makes me so excited for my next client meeting. They're going to be like, what are you on? And I'm just going to be so excited when I talk to them. So
I love it. I love it. Well, thank you. I'll include all the information where people can reach out and connect with you. And I'm so grateful that you're doing this work in the world. Thank you.
Thank you so much.
Before we go, I'd like to read a poem because poetry can reach our hearts in a different way. Poems can have us feel in a different way. And that's what this podcast is all about. Expanding our hearts, deepening our empathy, and inviting in joy. So each week, you get a new poem. The conversation I just had with Christina Hughes is sitting with me, and I'm thinking about the power of birth, the power of the systems within which we birth, and kind of that return to the core, kind of the core truth of birth, which is, being deeply in the body and feeling safe there. So it got me thinking about this poem by Linda Hogan, which is called To Be Held. To be held by the light was what I wanted. To be a tree drinking the rain, no longer parched in this hot land. To be roots in a tunnel growing, but also to be sheltering the inborn leaves and the green slide of mineral down the immense distances into infinite comfort, and the land here, only clay, still contains and consumes the thirsty need, the way a tree always shelters the unborn life, waiting for the healing after the storm, which has been our life. Thank you for joining me today. My hope is that you're feeling a little less alone and a little more seen. So until the next episode, you can find me on Instagram at fatjoy.life, on YouTube at youtube.com/@fatjoy, and on Substack at fatjoy.substack.com. And please do check out the episode notes for how you can connect with my amazing guest and for the links to the poem. All right, lovely. I am sending you off with my best wishes for an abundantly Fat Joy day, and we'll talk again soon.